Mr. Boyer.
Thank you. I'd like to first associate myself with the comments of Mr. Shadig. I'm a co-sponsor of his bill approving Health Care for All Americans Act. We can do a lot of things to help the American people in health care. You can take a radical idea of what we do to provide insurance for an automobile and say, you know what, maybe we ought to be able to buy our insurance across state lines. Maybe we ought to be able to pool our risks. Maybe, if you're a good driver, you get a good driver discount. Wow, maybe if you take care of your body, you exercise, put yourself into wellness programs, maybe you should pay a less premium. Wow. Maybe somebody that decides to smoke, there's one for you, Mr. Chairman. Someone who smokes, drinks, participates in bad conduct and behavior, unprotected sex, maybe bad things happen to them, maybe they should pay higher premiums. That's a radical thought, isn't it? Well, last night, here's what I did. I decided to, after putting in the full day, and I left my Army Reserve duty at 7:30, I get home at 8 o'clock, I cook dinner for myself and my son. At 9 o'clock, I crawl into bed. I crawled into bed with this, the bill. Now, when I crawled into bed, I did it with a highlighter, a pen, and a pad, and let me just tell you what happened. Now, I am an attorney. It is a very difficult read. I did not have the cross indexes with me. It took me 82 pages in the first hour. So by the third hour, I get to just past the part with the Medicare dish, and then I had to, that other side of your conscience, gets the whip out and says, no, keep going, keep going. You're like, no, I want to sleep. No, keep going. So I get to the market basket discount, or the market basket updates, and I just say I can't do it anymore. So it's after midnight, and I put it down at page 265. Then we get another one. I guess my point is, if this is what happened to me last night, I don't think any member of this committee has read this. And it is pretty stunning that we're marking up a bill, truly, that no one of this committee has read. Now, I'll continue to do my due diligence. Maybe by Wednesday I'll be able to get through the entire bill. Now, what I do know is that, as I understand this, the migration is truly a scheme to do away with a private insurance market that migrates over 100 million people into a government plan. And when you do that, as we listen to a lot of the testimony, it means less jobs, higher taxes, more taxes, truly, for more government control, more bureaucracy, higher deficits, more debt, less freedoms, less choice, less quality, increased waiting times, and the rationing of care. Welcome to government control of our health care. That means our hospitals get less revenue, and when the hospitals get less revenue, doctors get less revenue because we're going to tie it to the Medicare rates. Guess what? That means pressure comes on the government for more medical research. Less medical research out there means we dull the competitive and innovative edge of American health care. That's bad for patients.
Gentleman's time has expired.